When Ethiopian Airlines Flight 302 crashed earlier this year, killing all 154 souls on board, my heart sank. I didn't know anyone, but I've been through Addis Ababa en route to my work in East Africa. I know the excitement of people waiting to board their planes, the anticipation of family and friends waiting for flights to arrive, and the focus of the flight crews preparing for their next journey. But the same day, without any fanfare, without any headlines, 830 women died. We're losing our women around the world to pregnancy, labor, and delivery at a rate equivalent to 2 jumbo jet crashes each and every day. The majority of these deaths are occurring in low and middle income countries, so most of us don't even realize the tragedy that's unfolding. What, for many around the world, and particularly in high income countries, is an exciting, if daunting, journey towards new life, is seen by women in East Africa as a battle. So, this is why I'm stood here today. I don't want to talk about doom, gloom, and tragedy, because we've come a long way in reducing maternal mortality. We started with the Millennium Development Goals between 2000 and 2015, and those commitments and investments have continued post-2015 with the Sustainable Development Goals. These Sustainable Development Goals have been agreed upon by every nation-state around the world, and they're a commitment to a more sustainable and a more equitable society. We're looking at a world, if this agenda is achieved, where everybody is treated humanely, where nobody dies unnecessarily, where everyone has a livelihood, and where our environment is nurtured. These goals intersect, and I want to introduce you to 3 of them. The first is SDG 3 on health. The second is SDG 5 on gender equity. And the third is SDG 6 on water, sanitation, and hygiene, or WASH for short. Now, if I stand here and tell you that to deliver a baby, you need water and a clean environment, I'm sure most of you are wondering how on earth I managed to get invited to give a TEDx talk. But the reality is that at least 1/4 of healthcare facilities around the world, that's 1 in 4, don't have adequate water supplies. 17 million women every year give birth in facilities that do not have adequate WASH resources. When it comes to Uganda, 40%, only 40% of the low-level healthcare facilities have water on site. That's not running through taps in the delivery ward or in the operating theatre. That's just a water point somewhere on the grounds of the healthcare facility. When it comes to sanitation, toilets, to you and I, there aren't many. And they certainly don't have adequate sanitation. Again, when we're talking adequate sanitation, what are we really talking about? We're talking about separate toilets for men and women. We're talking about accessible toilets. We're talking about toilets with menstrual hygiene management facilities. This is not a high bar to meet. And then we've got hygiene. Hygiene is critical to control infections in hospitals, and newborn babies are particularly susceptible. And in Ugandan healthcare facilities, these hand hygiene stations may or may not have soap at the point of care, or they may have hand sanitizers, but these are not likely to be near the toilets. So this is the backdrop to my personal journey. About 10 years ago, I was introduced to Dr. Jean Chamberlain, an OBGYN. She set up Save the Mothers Canada. It's a not-for-profit organization, and they support a Master's in Public Health Leadership for maternal and newborn health in Uganda, and a mother-baby-friendly hospital initiative. This is now run locally by Save the Mothers East Africa, which is fantastic. Jean's belief was that as an individual physician, she couldn't possibly save the number of lives that she needed to make a difference. But if she educated physicians, nurses, healthcare community leaders, and politicians and journalists, and they understood the challenges and some of the solutions, and they were willing to advocate for change, then maybe, just maybe, some of these unnecessary deaths could be avoided. At the time, I was responsible for what I believe is a game-changing graduate certificate program. It's called, for graduate students, it's called Water Without Borders. And we established the program because we believed that students needed more than just an academic degree. What we need today is a new generation of transdisciplinary thinkers who can solve the growing and complex problems at the water, environment, and health interface. We need students who are able to bridge research, policy, and practice. We need people who are willing to engage with communities and to be able to tackle the wicked global problems that future generations are facing. Through experiential and problem-based learning, over 50 students have graduated from this program from English, philosophy, engineering, geography, public health, social work, across all of the disciplines, learning together, sharing their knowledge, and working towards solutions through their coursework that are facing people like Jean and her Ugandan colleagues. Some of these students have gone on to engage in academia. They're making a difference through governments, and they're making a difference through international development and research organizations such as the Stockholm Environment Institute. A mutual colleague and friend challenged Jean and I sometime early on in our relationship. And she challenged Jean to think about what WASH meant to maternal health and well-being. I was working in WASH in rural and remote communities, and she challenged me to think about what that meant for pregnant women in those communities and new mothers and their babies. The gauntlet was dropped, and so I did what any good professor does. I passed it on to my students. No. As one of the problems for one of the group activities, I tasked some of the students. A very generous donor offered $25,000 to a rural healthcare facility in Uganda. Honestly, that would be a development agency's dream. But the donor wanted a proposal in return. And so these students were tasked with writing a proposal for this rural healthcare facility. They went away, they researched what a rural healthcare facility in Uganda might look like, and they carefully crafted their proposal. And about halfway into the 6-week project, I threw them a curveball. Their facility didn't have any running water and it didn't have toilets. Suddenly, the equipment that would need sterilizing, the staff that couldn't meet their own daily needs, let alone do their job properly. And the proposal was on shaky ground. But the students went back to the drawing board and they came up with a proposal that met the resources that existed and the needs. But there's a criticism that's leveled against academics, researchers in general, and that is that the findings don't actually reach the people who can use them to make a difference. And so as part of this program, we engaged a knowledge translation piece. So these students, based on the findings from their group projects, they had to translate it for a different audience. Some people did white papers and briefing notes, others made videos, educational videos, and infographics. For this particular project, we had one student develop skits, community skits, to communicate the importance of WASH for maternal health, but also for family health. We gave these skits to a not-for-profit in Kenya called Kohesu, who, among amazing community health initiatives, engage with high school students. And they helped those high school students to develop and provide skits back to elementary school students and to communities. Another student was tasked with developing an outline of a professional development course on wash and maternal health. With their permission, a colleague and I turned that into a full 4-hour module, complete with how to take and test a water sample. In future years, when I took students to Uganda through Water Without Borders, I gave this module to the Save the Mothers and the Water Without Borders students. And we provided a simple water quality testing kit so that we used it in the module, but students could also take it to their places of work, which were mainly healthcare facilities, and they could use it in their research. Over the years, the reach and impact of the education, the research, and the collaboration has grown. Now, if you know me, you're not allowed to answer this next question, but I'd like to know how many of you have heard of World Toilet Day? Yes, it's a day, and there's no one with their hands up. World Toilet Day is a day of advocacy and awareness, November 19th, every year. In 2013, it became a UN-sanctioned day, and it had the theme of gender and sanitation. So I engaged Jean and some of her colleagues, and we developed a video on what happens if you don't have sanitation in a maternity ward, and what it looks like, and why it's important. And we showed that in the UN headquarters in New York on World Toilet Day that year. Another time, I introduced Jean to H2O for All, a not-for-profit who puts toilets and water into communities. And now, Koala Hospital in Uganda has running water in their maternity ward. They have a clean ward, and they have really, really proud staff. More students have passed through both programs. More research is being undertaken on the linkages between WASH and maternal health. Some of these have actually been done together collaboratively. There's been a technical program that's been developed in Uganda, a professional graduate program in water and sanitation. And since the first graduating class, they've trained about 40 professionals in water and sanitation. Queen Elizabeth scholars traverse the ocean. They're building more capacity. They're developing more research proposals, and they're driving policy and practice. It started with a simple observation. A healthcare facility that didn't have taps, or didn't have water in its taps, and didn't have toilets. It was a small idea. Every single healthcare facility should have adequate wash resources. We've built multiple bridges. We've built them between individuals, institutions, governments, organizations, communities. These bridges, they've strengthened, they've multiplied. Some have taken on lives of their own, and that's absolutely fantastic, because the bridges between people and places, policy and practice, built on data from solid local research, these are the elements for affecting meaningful change. And meaningful change, that's essential for a more equitable and sustainable society. One where women who are pregnant don't have to see it as a battle that they're either going to win or lose. Thank you very much.